blood vessel distribution and vessel distribution. Okay? Functional patterns of the pulmonary and systemic circuits. Remember, the pulmonary circuit pumps blood from the heart to the lungs, back to the heart. Systemic circuit goes from the heart, the entire body, back to the heart. Okay? So the pulmonary system drains blood back into the left atrium. The systemic system drains blood back into the right atrium. Okay? So the distribution of arteries and veins is the same on the left side of the body as on the right. We're mirror images, okay? Except for the vena cava. Okay, there is only one vena cava. There's a superior vena cava and inferior vena. There's not a right and a left. There's right and left for all the other veins and arteries, but the vena cava and the aorta, there's only one. Okay, there's no right and left vena cava. Okay, so the vena cava and the aorta are singular. Okay, they run down the middle of the body. Okay, a single vessel will have different names according to where it is anatomically. Just like we said, the descending aorta is on, if it's in the above the diaphragm, it's called the thoracic aorta. Once it passes the diaphragm, it's still the descending aorta, but it's called the abdominal aorta. It depends what part of the body it's in that we're talking about. Arteries and veins often anastomose. Anastomosis means it branches into a whole bunch of branches and intertwine and intertwine with each other. That's an anastomosis. All the little things intertwine. Okay, and that just makes sense because arteries are pumping blood away from the heart and veins are going back to the heart. They got to meet somewhere. And they meet by these anastomoses where they tie into each other with these very thin areas so blood can be exchanged. Oxygen can be exchanged. So blood on the right side of the heart is on its way through the pulmonary circuit. Okay? So from the right atrium to the right ventricle pumps into the pulmonary valve, which is semilunar valve is what I was thinking of, semilunar, right? It's a semilunar valve. Okay, so it goes from the right atrium to the right ventricle through the tricuspid valve. Then it goes from the right ventricle through the semilunar valve into the pulmonary arteries. Goes in the pulmonary through the pulmonary valve, pulmonary trunk, into the pulmonary arteries. Okay, so this is deoxygenated blood. Okay, leaves the heart from the right ventricle. It goes through the pulmonary valve, which is a semilunar valve, goes in the pulmonary trunk. The pulmonary trunk then branches into left and right pulmonary arteries. The pulmonary arteries go into the lungs. Okay, they go to the lungs, they give off CO2, and they take in oxygen. Okay, that oxygenated blood returns back through the pulmonary veins. The pulmonary vein goes into the left atrium. Okay, so that's the right side circulation. That's the pulmonary circuit. Okay, that's we oxygenate our blood. Okay, so again, here is your, let's start with, where do we want to start with? Where is our pulmonary trunk? Okay, so here's the pulmonary trunk. This is the right atrium right here. This goes through the tricuspid valve, goes to the right ventricle. The right ventricle goes through the semilunar valve right here, okay, which is your pulmonary valve, goes to the pulmonary trunk. Pulmonary trunk is going to branch to the right and left pulmonary arteries. And it goes to the lungs. Here's your right lung, there's your left lung. Okay. Now it goes back. At the lungs, it gives off CO2, takes in oxygen. Okay. So the right pulmonary arteries bring it to the lungs, deoxygenated blood to the lungs. The pulmonary veins take that oxygenated blood and bring it back to the left ventricle. Okay, your aortic arch where it pumps, so it goes to the left atrium. I'm sorry. The pulmonary veins bring it back to the left atrium, goes through the bicuspid valve, left ventricle, then through the aorta. Okay, ascending aorta. We got all that. And at the lungs, and we talked about these little alveoli here. This is the blind sacs of the lungs where oxygen and CO2 get exchanged. They're very thin and very numerous. They're little like street cul-de-sacs. They're little blind pockets. Right? That's where your blood exchange occurs. This is where the damage. You have a patient with COPD. Okay, COPD in the average lung. You got all these little circles, all these little alveoli where lots of gas and huge surface area. In COPD from smoking or other effects like that, all these areas smooth out. So you have this one sac now. Instead of thousands of sacs, you just have one sac. So surface areas really decrease. That's why when a patient with COPD breathes in, they don't get as much oxygen. They get winded easily. Okay, the oxygen exchange is not as great because the surface has been reduced so much because all these little sacs have been destroyed. And now you just got this one big sac in the lung. So you've gone from this to this. Okay, so all this increased surface area is gone in COPD patients. That's why they can't breathe in. They can't get enough oxygen. Okay, you've also got up here your superior vena cava. Superior vena cava drains blood into the right atrium. The inferior vena cava drains blood into the right atrium. And the descending aorta comes down after the aortic arch and goes to the thoracic aorta into the abdominal aorta. All right, I think we got that picture. The systemic artery. So now we had blood going back into the left atrium from the pulmonary veins, right? Drops in the left atrium. So oxygen, blood on the left side of the heart is on its way through the systemic circulation. Okay, so it goes from the left atrium to the left ventricle. Okay, the left ventricle, and this goes through what's called the bicuspid valve. Okay, that is your mitral valve. You'll hear it called. Okay, it goes through the bicuspid into the left ventricle. The left ventricle pumps, it goes through the semilunar valve, or which is an aortic valve. Again, the aortic valve is a semilunar valve, just like the pulmonary valve. It goes to semilunar valve, and it goes through the left ventricle, through the semilunar valve, into the ascending aorta. Okay, at the base of the ascending aorta, the branch for the coronary vessels. So the first thing that gets blood coming off the aorta is the heart. The branch is right at the coronary vessel before the aortic arch. Then the aortic arch branches. The aorta branches to form the aortic arch. And then from there it goes in all the numerous vessels of the body. Remember, there's three branches I wanted you to know that come off the aortic arch. There's a brachiocephalic trunk. There's the left common carotid and the left subclavian. Those three arteries. All right, so here's our overall diagram what we talked about. It shows the systemic circuit, which is the entire body, and it shows a pulmonary circuit. Just, you need to remember there's two circuits in the body. When you measure blood pressure at the clinic, or at your emergency room, or at your doctor's office, or physician, or nurse practitioner, whenever you're measuring blood pressure, you're taking the systemic pressure. Remember, there's two systems. Okay, so all the of hypertension, you need to check something different. Again, systemic circulation goes through the entire body. Pulmonary system goes through the lungs back to the heart. So blood in the aortic branches branch the flowing vessels. This is the three you needed to know. It comes up. This is your ascending aorta, your aortic arch, and then your descending aorta. So this is your ascending aorta, AA, your descending aorta, PA, and you have three branches that come off of here. Your coronary branches come out of here that go right to the heart. Bring blood supply to your heart. Okay. So the brachiocephalic trunk is the first one. This is this one right here. That's your brachiocephalic trunk. Okay. That branches the right common carotid and the right subclavian arteries. The left common carotid. Okay. And the left subclavian. So left common carotid artery and the left subclavian artery. All branch off the aortic arch. Then it goes down into the descending aorta. And then you get the rest of the branches. Okay. So if you look at the heart, you can see here's it coming off the aorta right here, coming into the aorta. This is your ascending aorta. Where's your left valve? I'm pointing the wrong way. This is your left ventricle, pumps up into the ascending aorta. Then you get your arch right here. So you get your ascending aorta, aortic arch, and then you get the brachiocephalic trunk, which is the first branch off it, the left common carotid, which is the next one off it, and the left subclavian artery. And then the aorta keeps going down to the descending aorta, where it becomes the thoracic aorta, through the diaphragm, and becomes the abdominal aorta. Okay. So the ascending aorta begins at the aortic valve, the semilunar valve. You get left and right coronary arteries branch off the base of the ascending aorta. Goes to the leg, goes right to the heart to provide blood to the heart to keep the heart muscles going. Then it forms the aortic arch, which forms an arch going to the left and posterior sides of the heart. Okay, the arch forms towards the left and posterior side of the heart, goes on behind it. Branching off the aortic arch are the three elastic arteries, which you talked about: brachiocephalic, left common carotid, left subclavian. All right, so these are the three arteries we talked about that I told you I wanted you to know. The brachiocephalic front trunk is the first one. Okay, and it gives rise to the right subclavian artery, which supplies blood to the right side of the head and the brain, and to the right subclavian artery, which supplies blood to the right arm. You get the left common carotid artery, supplies blood to the left side of the head and brain. And you get the left subclavian artery, supplies blood to the left arm. So the big thing you got to think about is when you get that coming up the aorta, the first branches go right to the heart. They're not putting blood in the heart. They're supplying blood to the heart muscles, so the heart keeps pumping. Okay, then the first one comes up, goes to the brain. The second comes up, goes to the left side of the brain. So we're getting blood supply to the heart and blood supply to the brain, which is two important organs we need. Okay, that's where most of our blood supply goes, right there, right off the bat. Okay. This is an angiogram. Okay, a live view of it. You can see this is what we do. We suspect coronary disease. Someone has a embolism. Someone has arteriosclerosis, hardening of the arteries. You can see that, or plaque buildup. We can see that on angiograms. We inject dye and we follow it on this the angiogram, this X-ray. So here's your ascending aorta, comes up, and this is your aortic arch, and then this is your descending aorta. Okay, this first branch is the brachiocephalic trunk. It comes up and feeds into the right subclavian artery going down the arm, and to the right common carotid artery, which goes into the right side of the head and the brain. This is the left common carotid artery branching off, and this goes to the left side of the brain. And then the left subclavian artery branches off and go down to the left side of the body, the left arm. Okay, so you can see those arteries very clear on this angiogram. Okay, this is another angiogram. Now we got a problem. You can see the aorta. This is exactly what you're gonna be looking at in the medical field. You go into an emergency room, physician's office, when patients complain of chest pain, they take one to see why. Here's your aortic arch, brachiocephalic artery, left subclavian artery, and look right here. What do you see? Okay, you see no blood flow. You see a blockage. Okay, that's the left subclavian artery feeding up into there. Okay, the left side of the body, left arm going up here and up to the side of the head. These are getting no blood up in here. This is almost a complete blockage. That's an emergency surgery. That's got to be opened up. Okay, or you're not going to live very long. All right, everybody can see that blockage, right?
Yes.
Okay.
So that's why whenever they complain of left arm pain,
yep.
you know.
That's one of the things. Yep.
Bingo. All right.
Yep. And how you treat that is a stent. You put in 1, 2, 3, 4, up to 7 stents. I think I've seen put in. But a stent goes in there. They basically put a balloon in here, open this back up, and they put basically a one-way valve like this that opens it so blood can flow. And this pushes this already open and keeps it open. And that's a stent. Again, you can see the constriction. Okay, not quite sure. That's going on the left, probably the left subclavian. Not a great picture, but you can see the blockage on that angiogram. That's what we're looking for with the angiogram. We're looking for blockage, a discontinuous flow of the bloodstream. All right, systemic arteries. So that's the pulmonary arteries. Okay, this is now systemic artery. This is subclavian arteries. Okay, subclavian arteries continue to form into the axillary arteries. So subclavians branch into the axillary. Prior to forming the axillary arteries, subclavians form 3 branches. So your subclavian arteries coming off from the aortic arch, from the thyrocervical trunk, the internal thoracic artery, and the vertebral artery. Okay, that's before they form into the axillary arteries. So the thyrocervical trunk supplies muscles of the neck, head, and upper back. The internal thoracic artery supplies your pericardium, the sac around the heart, and anterior walls of the chest. Vertebral artery supplies the brain and spinal cord. Okay. And here you can see this is your this is the aortic. This is the aortic arches down here. These are your branches coming off it. This first branch is a brachiocephalic trunk, which is located right here. This is your brachiocephalic trunk. The brachiocephalic trunk continues on up to form up into the common carotid. It comes into here to form the internal thoracic. Okay, this is the axillary as it comes down into the right arm here. Okay, and it forms your thyrocervical trunk, vertebral artery going to the brain, the thyrocervical trunk, and that was your subclavian coming across, and your internal thoracic. The flow of blood from the subclavians. Okay, you got the axillary artery. Once it becomes the axillary artery, it forms into the brachial artery. Then it branches into the radial and ulnar arteries. It goes down both sides of the arm. The radial go down to the thumb side. The ulnar goes down the medial side of the arm. Arteries anastomose at the wrist, forming the superficial palmar arch and the deep palmar arch. Remember, arteries have to turn into veins. And they turn into veins at anastomoses, where they branch into real small fibers and they interweave with each other. Okay? And we control the blood flow through those areas, through those capillary beds. So then again, here's your right axillary coming down. Right axillary breaks into the right brachial. The right brachial breaks into the right radial and the right lunar. Same exact thing on the left-hand side. So the axillary artery goes into the brachial artery goes into the radial artery and the ulnar artery. And the anastomose in the deep palmar arches and in the superficial palmar arch. Okay, you can see this from these bed structures where everything intertwines with each other. And these are your anastomoses. This is where your arteries turn into veins, where the blood's going away from the heart, circulates, it goes back to this anastomosis system, and it starts going back to the heart. That's all it is. It's like a traffic circle. Think of it that way. It spins it right back around, comes back where it came from. Okay. This is just a cadaver view of it. Here's your axillary artery. Come across, and that forms your brachial artery. And this goes down here. Brachial artery comes down. Okay, it forms the ulnar artery and the radial artery. Whoa, where am I going? The ulnar artery comes down through here, then the radial artery. Those two branch off. And then at the end of it forms the superficial and the deep palmar arches. Okay. The common carotids. The common carotid arteries go up the neck. They divide to form your internal and external carotid arteries. The carotid sinus, okay, is at the base of the internal carotid artery, consists of a baroreceptor and chemoreceptors. They determine, baroreceptors measures pressure. So it determines your blood pressure and allows your body to adapt for it with angiotensin, we talked about, whether we release antidiuretic hormone to increase water and increase blood pressure or decrease blood pressure. Okay, those are your baroreceptors. Okay, chemical receptors measure the concentration of partial pressure of oxygen, partial pressure of CO2. They determine your breathing, whether you need more oxygen or less oxygen inside the bloodstream. Okay, that's all done at the carotid sinus. Okay, so here's your internal carotid artery. Again, coming off the common carotid, here's your common carotid. Again, your brachiocephalic trunk, the first branch off thing, here's your aortic arch. This is the first branch off and comes down and forms into the axillary artery, and it forms into the common carotid. Common carotid branches into an external and an internal carotid artery. Okay, and right at the beginning of the internal carotid, this little guy right here, this little swelling, that is your carotid sinus. And inside the carotid sinus is a baroreceptor and a chemoreceptor. Baroreceptors measure pressure. Chemoreceptors measure the partial pressure of oxygen and other chemicals like carbon dioxide and oxygen. That's where the carotid sinus is located. All right, so your external carotids. Remember, there's internal and external. The external carotids supply the neck and outside the skull. And these external carotids branch from your lingual artery your facial artery, occipital artery, and the superficial temporal artery. Remember, the lingual artery goes to the tongue, facial artery goes to the side of your face, occipital artery goes to the back of your head, superficial temporal artery goes to the side of your head. We know where all those areas are located. You know where your tongue is, you know where your face is, you know where the occipital bone is, and the temporal bone. So just by learning this bone, we know where these arteries are going. Those are your external carotids. Okay, you can see the occipital artery. Here's your, where are we all back here? This is the aortic arch right here. This is the first branch, and then you come up here. So this branch is your axillary, and this goes up to your common carotid and your internal carotid and external carotid. So the external carotid comes up here. This is your external carotid, and it branches into the lingual to your tongue, facial, occipital, and then the superficial temporal. Okay. The internal carotids go deeper. Okay. They enter the skull to deliver blood to the brain. Okay. They branch to form three different arteries: ophthalmic artery, anterior cerebral artery, and the middle cerebral artery. If you had to guess, the ophthalmic artery would supply the eyes. The cerebral artery would supply the frontal and parietal lobes of the brain, you know where the frontal and parietal lobes are, and the middle cerebral artery supplies your midbrain and the lateral surface of the brain. Okay. Blood supply in the vertebral arteries reach the brain through, okay, the left and right vertebral arteries fuse to form what's called the basilar artery. The basilar artery branches many times in the area of the pons, right in front of the cerebellum. Gives multiple branches to supply blood in that area. The basilar artery eventually forms what's called the circle of Willis. This is a cerebral arterial circle. Okay, and it's just arteries that come in and they form basically a circle around the base of the brainstem, and they come back up. So they deliver multiple blood vessels here for anastomosis into the areas around the pons. Okay, so here's your basilar artery coming up. So it comes up and forms. And it forms its branch of circles. It's going to go around and circle around just superior to the pons. Okay, you can see the middle cerebral artery. This is the internal carotid where it comes up. This is the other internal carotid right here. And it forms in the basilar artery. And then this is your vertebral artery, comes up from the vertebrae. Okay. And it forms the posterior cerebral, the posterior communicating, the anterior cerebral, and the anterior communicating. And this is a cerebral arterial circle, or the circle of Willis. And this is a circle of blood supplies that go around just superior to the pons, circling around the midbrain to provide blood into that area. Okay, again, here's your circle of Willis. Okay, this is your middle cerebral artery coming in. This is your anterior cerebral arteries, your posterior cerebral arteries, your posterior communicating arteries. Okay, and you see how it just forms a circle right here, just superior to the pons coming in. And this is the basilar artery, which comes up. This is the main one that comes up and begins the circle of Willis. You can see it right here on the larger view. Okay. All right, the descending aorta. Now we got all that. That's from the ascending aorta, the aortic arch, all the branches through those veins up to the head and neck and the heart. And now we got the descending aorta. Okay. It's a continuation of the aortic arch. Remember the heart, the left ventricle pumps your blood. That's your ventricle, pumps it out through the semilunar valve, through the aorta. Ascending aorta, aortic arch, descending aorta. And there we go. That's where the descending aorta comes down. Okay, divided into thoracic aorta and the abdominal aorta. Remember, it's called the descending aorta above the diaphragm. Okay, it's called the abdominal aorta. The descending aorta below the diaphragm is called the abdominal aorta, just by where it's located, in the thorax or in the abdomen. Okay, it's still the descending aorta. You're just labeling by what position it's in, where it's at. So here's your aortic arch coming up, and it comes up. Here's your left ventricle where it would be up here, aortic arch, it starts to come down. There's your descending aorta. This is a thoracic aorta. Here's your diaphragm. Once it passes the diaphragm, it becomes the abdominal aorta. Okay, so far so good.
Yes.
All right, cool. All right, now the thoracic arteries. So branches from the descending aorta that are in the front where it's the thoracic aorta, it branches off. It branches onto the bronchial arteries, the pericardial arteries, mediastinal arteries, esophageal arteries, intercostal arteries, and the superior phrenic arteries. Those are all branches of the thoracic aorta. Okay, so here's your, let's just go right down the list. This is your esophageal arteries, branch off. You can see where they feed into the esophagus, where it's located right in here. This is your pericardial arteries, branch off in the pericardial sac of the heart. Superior phrenic arteries branch off just above the diaphragm. Remember, the phrenic nerves were right to the anterior part of the diaphragm. The intercostal arteries feed along the ribs. The mediastinal arteries are right here, and they feed, the mediastinum is the area between what's called the apex of the lungs. The lungs come up and form, we haven't talked about it yet, but the lungs come up and they'll form points coming up towards the top. Okay, between the lungs, at the tip of those, the apices of the lungs is what's called the mediastinum. That's where these areas supply blood to the top part of those lungs. And the bronchial arteries supply blood to the bronchial tubules coming down as the trachea comes down and starts to branch into different bronchi. Okay. Now we pass through the diaphragm and we got more branches. This is the abdominal aorta. Again, still the descending aorta. We have the celiac trunk, the superior mesenteric artery, the inferior mesenteric artery, the inferior phrenic arteries, the suprarenal arteries, the renal arteries, gonadal arteries, lumbar arteries, and the common iliac arteries, right and left. So coming down from, here's your diaphragm again. This is a dividing point, remember, for your aorta. Okay, you have your inferior phrenic nerves, inferior phrenic arteries. They're just below the diaphragm. You have the suprarenal arteries, which supply the suprarenal glands or the adrenal glands. You have the renal arteries, which supply the kidneys. Okay. You have the lumbar arteries that come into the lumbar area of the vertebrae, the right common iliac and the left. Where's the left? Doesn't have left on here. But this is the right common iliac and the left common iliac as it comes down. Goes through the inguinal canals on both sides. You have the inferior mesenteric, okay, and the superior mesenteric. And you have your celiac trunk where the celiac ganglia run. Okay. The celiac trunk, once it branches off, supplies the liver, the stomach, the esophagus, the gallbladder, duodenum, pancreas, and the spleen. Okay, it supplies all those organs. Okay. Branches to form the left gastric artery, the celiac trunk, and that supplies your stomach, and it forms the splenic artery. The splenic artery supplies the spleen. The left gastroepiloic artery supplies your stomach, and the pancreatic artery supplies the pancreas. Okay. Then the common hepatic artery that branches from the celiac trunk. Okay. That forms the hepatic artery proper, which supplies the liver. The right gastric artery, which supplies the stomach. The cystic artery, which supplies your gallbladder. And the gastroduodenal artery, which supplies the duodenum. It's the beginning part of your small intestine. Okay. And this is the pictures of it. This is the abdominal aorta. You can see right in here, coming down through here. You can see the left gastric. You can see the splenic. Again, here's your spleen. Here's your pancreas. The left gastroepiloic supplies the stomach, and the pancreatic supplies the pancreas. And let's go to the right gastric, supplies the stomach. The gastroduodenal supplies the duodenum, because here's your stomach, and this is a duodenum. This is the first part of the small intestine. This is your duodenum. That's where the gastroduodenal arteries feed into. The cystic supplies your liver. Hepatic artery proper supplies the kidneys, and the common hepatic supplies into the kidneys. All right, so who's paying attention? What's that pointing to?
Trachea.
Trachea. I think we're going to go this direction, but I'm not 100% sure. So what's this pointing to right here? Let's do this one. This is pointing to this right here. This is what?
Aorta.
This is what?
The ascending aorta.
Ascending aorta, because here's your left ventricle. And it's pumping blood up through the semilunar valve, And this is going into the left. This is going into the ascending aorta. Perfect. And the next one, this one here, is going, blood is going this direction. This is the what? What brings blood into the right atrium from the top, from above it?
Superior vena cava.
Perfect. Exactly. Superior vena cava. Very good. All right. And then the next one points to the, let's point to this whole big thing here. What's this thing?
The right lung.
Yep. That's your lungs. That's on the right side. It's your right lung. And then that one's pointing to, can't tell. Can I make it bigger? Yeah. That one's pointing to this blue area right in here. Okay.
Pulmonary veins.
Those would be your pulmonary. Oh man, I didn't mean to do that.
Arteries?
Okay, those are
Mhm. I would go with the pulmonary arteries.
okay. Right pulmonary arteries. That's
Yeah.
Deoxygenated blood, very good. Then the red one's going back to the heart R.
Right pulmonary veins.
You got it, right pulmonary vein. Very good. All right, and this blue tube right here, coming up right there. This would be
Inferior vena.
inferior vena cava.
Inferior vena
And
cava.
this coming down here would be the
Descending aorta.
descending aorta, or what else could be called? It's below the diaphragm. Because here's the diaphragm.
Abdominal aorta.
It could be either one. I give you credit for either one, descending aorta or the abdominal aorta.
Abdominal.
But it's not the thoracic aorta because you're below the diaphragm there. All right, so I think I'm going right here next. I think I'm going around the circle. So let's try that. This are
Capillaries.
capillaries. Okay. Okay. That's your small blood vessels where blood exchange is occurring. What are these sacs called? Where all this gas exchange occurs. Remember,
Alveoles.
alveoli. Yep.
Alveolus.
The alveolus.
How do you
or
pronounce
alveoli.
that?
The what?
How do you pronounce that?
Alveoli.
Alveoli.
And this is plural, so it's alveolus is plural for
Yeah.
alveoli.
Mm.
And those are the blind sacs that fall
Alveoli.
into the lungs. And this is what surfactant coats so don't collapse. And this is what COPD patients are missing. It smooths those all out so you don't have that surface there anymore.
Mm-hmm.
And then this points to
Left pulmonary veins.
Mhm.
left pulmonary vein. This one points to the right pulmonary, left pulmonary arteries, right? Yeah.
Yes.
Okay, and this is going to this area right in here. What's this called?
Left lung.
Left what?
Left lung.
No,
Is it the big structure?
Yeah. Wait a minute. What's it pointing to?
Or
Oh wait,
I
wait.
think-
You're right. You're right. I was looking at the wrong arrow.
I was gonna say that's the lung, right?
That's the
We
lung.
got that at least.
I was looking. I circled this area here, and I'm going. I was doing the next one up. That's the left lung. You're right. Now what's that pointing to? Now it's pointing to the red circle.
yeah,
That's the area before it goes to the right pulmonary
mm,
artery.
trunk.
That's the pulmonary trunk. That's the area it's looking at. Yep. And then what's that called? Where it makes like a McDonald's sign.
The aortic arch.
Aortic arch. Your superior mesenteric artery branches to supply the pancreas, the duodenum, small intestine, and the large intestine. When it branches to the pancreas, it branches to the inferior pancreatic duodenal artery. When it branches to the duodenum, it branches to the inferior pancreatic duodenal artery. So both these go to the pancreas and to the duodenum. The small intestine gives you intestinal arteries, multiple arteries here. Small intestine is where most of your absorption of your food comes from. So it's going to have a huge blood supply there because you have to carry those nutrients into the body. So the intestinal arteries is a large branching off of that mesenteric artery. The large intestine has the right colic artery, the middle colic artery, and the ileocolic arteries. Okay. So here's your superior mesenteric artery coming down. And this is going to, I can't see it down there. It's red right there. Okay. And it's going to branch into the inferior pancreatic duodenal artery. And that goes to two things. It goes to the pancreas and it goes to the duodenum. Okay. Then you have the middle colic artery coming down. You have the right colic artery and the ileocolic artery. And then you got your intestinal arteries. Now look at the intestinal arteries. Look at the difference here between these arteries and this side, and look at all those mass arteries. That's a huge amount of arteries, the arterial system. That's where most of your absorption is occurring. Okay, that's you have most of your blood supply there. Okay. The inferior mesenteric artery branches to supply the terminal portion of the large intestine, which is your left colic artery and your sigmoid arteries, and the rectum. These are your rectal arteries. Okay. Whenever you see the word sigmoid, it just means S-shaped. That's what sigmoid means. Sigmoid is the Greek letter, it's S. So we call the sigmoid artery, means it's going to be an S-shaped artery. So here's your inferior mesenteric. It branches down to your left colic, your sigmoid. Again, here's your sigmoid arteries flowing down here. And that forms into the S shape of your sigmoid colon. Right, here's your S shape. And then your rectal arteries is formed around the rectum. Okay. There's 5 paired arteries branch off your descending aorta. Okay, after it becomes the abdominal aorta. The inferior phrenic arteries, the suprarenal arteries, the renal arteries, gonadal arteries, and the lumbar arteries. Okay. The 5 paired arteries supply the inferior phrenic arteries, which supply the superior inferior portion of your esophagus and your diaphragm. The suprarenal arteries supply the suprarenal glands. The renal arteries supply the kidneys, right and left. Gonadal arteries supply the testes, scrotum, ovaries, or the uterine tubes in the uterus, depending if it's male or female. And the lumbar arteries supply your vertebrae, spinal cord, and your abdominal wall. Those are your 5 paired arteries coming off this, this superior mesenteric artery. So there's your inferior phrenic, just below the diaphragm. There's a suprarenal artery supplying the suprarenal glands or the adrenal glands. Your lumbar artery supplying the abdominal wall and the lumbar vertebrae. And your gonadal artery supporting your testes, the testes in males, ovaries in females. And that was it for that one. Okay, arteries in the pelvis and the lower limbs. The descending aortic branch also branches from your common iliac arteries. Okay, you have the internal iliac and the external iliac. Just like on top, it branches from the internal carotid and external carotids, the common carotid. So this is a common iliac. Okay. The internal iliac goes to your urinary bladder, walls of the pelvis, the external genitalia, and the medial sides of your thigh. The external iliac arteries supplied blood to your legs. All right, so here's the common iliac branching off the descending aorta. And it branches into the external iliac and the internal iliac. Okay, areas of your thighs and legs. This was the external iliac, forms your deep femoral artery and your femoral artery. The femoral artery continues on the popliteal artery around your kneecap. The popliteal artery bifurcates, forms 2, forms the anterior tibial and the posterior tibial arteries. The posterior tibial then branches and gives rise to the fibular artery. Okay, so here's your external iliac coming down and branches from the common iliac off of the descending aorta, and it forms your deep femoral artery, comes down and branches, and then the femoral artery branches into the popliteal artery where it branches into the anterior and posterior, okay, tibial arteries. And the fibula, and then it branches into the fibular artery. And same thing we just did. You see the deep femoral artery, okay, from the femoral artery, from the right external iliac, okay, branching in the popliteal, which we talked about, going into the posterior and anterior tibial arteries, and the posterior tibia branches into the fibular artery on the backside. In the foot, the anterior tibial artery forms your dorsal pedis artery. The posterior tibial artery forms the medial and lateral plantar arteries. There's a lot of arteries here, and I'll go back into all the veins too. So the posterior tibial comes down into the posterior and anterior tibial artery. The anterior tibia forms a fibula. Fibula branches into the dorsal pedis and the lateral plantar and the medial plantar arteries as it comes into the foot. All right, those are all the arteries from the head to the top of the toe, for the top of your head down to the toes. Now, the blood's got to get back. So now we got veins. You got to carry all the blood back to the heart. So veins collect blood from body tissues and return it to the heart. That's what veins do. Okay? Blood returns to the heart from your lower extremities, okay, via the inferior vena cava. Inferior vena cava feeds in the right atrium. Okay, this is from the lower extremities. Blood returns to the heart from the upper extremities by the superior vena cava. Okay, both inferior vena cava. There'll be a question on your test. It says true or false. It says blood is returned. What does it say? It says the right. Let's see. The superior vena cava drains into the right atrium, and the inferior vena cava drains into the left atrium. True or false?
False.
False. The superior vena cava and the inferior vena cava both drain into the right atrium, along with the coronary sinus. Those three veins drain into the right atrium. They all bring deoxygenated blood back to the heart. Okay, so don't get confused here. Just the superior is draining to the top part of the body, inferior is draining from the bottom part of the body. And blood comes into the heart from the lungs via the pulmonary veins, and the pulmonary veins drain into the left atrium. So the superior vena cava, the inferior vena cava, and the coronary sinus drain into the right atrium. The pulmonary veins drain into the left atrium. The superior vena cava, the inferior vena cava, and the coronary sinus bring in deoxygenated blood. The pulmonary veins bring in oxygenated blood. Okay, so here's your superior vena cava draining into the top of the right atrium. This is your inferior vena cava, drains into the bottom of the right atrium. Okay, these are your pulmonary veins, which bring blood back into the, where am I at? Left atrium. These are the left pulmonary veins, right pulmonary veins, and then the inferior vena cava comes up. Okay, and so you see your superior vena cava, and you see the inferior vena cava. Inferior vena cava drains from the bottom, below the diaphragm. Superior vena cava drains from the top, arms are above the diaphragm. All veins in your body drain into the superior vena cava and the inferior vena cava, except the pulmonary veins, which are draining from the lungs, and the cardiac veins, which go to the carotid sinus. Okay, so the superior vena cava receives blood from your head, the neck, the chest, the shoulders, and the upper limbs. Okay, the superior cerebral vein drains into the superior and inferior sagittal sinuses, the petrosal sinuses, occipital sinuses, left and right transverse sinuses into the straight sinus. This is all venous return from the skull, from your cranium. Okay, that's your superior cerebral brain and what it's going to drain into. So venous blood from the cranium drains into the internal jugular vein, which drains into the brachiocephalic vein, which drains into the superior vena cava. So these are the veins in the skull from the cranium. You have your superior sagittal vein, the straight sinus, petrosal sinus, and the right transverse sinus, and the occipital. Okay, and then the inferior sagittal sinus. And then you have your internal jugular vein draining into the right brachiocephalic vein, draining into the right subclavian, draining into the, oh, going backwards, draining into the superior vena cava. Sorry about that. So you got all your cranial veins, okay, draining into the internal jugular, which drains into the right brachiocephalic, which drains into the superior vena cava. So venous return from the cranium, the venous blood from the posterior skull and the cervical spine drain into the vertebral arteries, which drains the brachiocephalic veins, which drains into your superior vena cava. Okay, so here's your vertebral artery coming down. It drains down through here, and see it's going to drain into the right brachiocephalic vein into the superior vena cava. Now, these are the exact opposite of the circle of Willis. These ones that correspond to it. Remember, arteries and veins run together. So this is the venous system. This is the return from the brain. So this, again, is your internal jugular, petrosal sinuses, superior sagittal sinus, which you see runs along the sagittal area, the sigmoid sinus, the transverse sinus, the straight sinus, and occipital sinus. Okay, and they're all going to feed into coming back through this internal jugular vein. Okay. Drains from the head. You have the temporal vein on the side, the maxillary veins, and the facial veins. The temporal veins drain into the external jugular, then into the subclavian. Okay. The maxillary veins also drain into the external jugular, then into the subclavians. And the facial veins drain into the internal jugular, and then into your subclavian veins. So this is your temporal vein, maxillary, and your facial. All the parts of the ones that we already know. And those drain into the, you can see the temporal comes down here. Okay, the maxillary comes down here, drains into the external jugular. The facial drains into the internal jugular. And both those are going to come down here, draining into the right brachiocephalic, into the superior vena cava. And let's go a little bit, then take a break. 15 minutes here. So venous returns from the upper limb. Okay, just like you did with the hands, it drains from the digital veins, just at the start of the fingers, from the superior and deep palmar veins. Superior palmar veins drain into the cephalic vein, to the subclavian, to the brachiocephalic, to the superior vena cava, to the right atrium. The exact opposite is going with the arteries. Okay, so you can see you're coming down from the digital veins to the palmar venous arches, from your anastomosis, up in the cephalic vein, up in the brachiocephalic, to the subclavian, into the superior vena cava. Okay, can also go, okay, there's multiple ways the blood can drain through. You can go from the superior palmar veins into the cephalic vein. You can go to the median cubital vein, the basilic vein, the axillary vein, subclavian, now back in the brachiocephalic, superior vena cava, right atrium. It's always going to end up from the arm, from the superior vena cava into the right atrium. Okay, so here's the palmar venous arches, and you can go through the cephalic vein to the median cubital, into the basilic vein, into the axillary, brachiocephalic, the subclavian, and again, drain into the superior vena cava, into the right atrium. Okay, let's do one more, then we'll take a little break here. Blood can return from the heart through the hands by the superior palmar veins now, and the basilic vein, to the axillary vein, subclavian, brachiocephalic, away from the area. Wait, come on. Come on, get away from it. Here, you hit my wires. Dog's trying to play with all the wires. All right. So, okay, from the brachiocephalic vein, can feed into the superior vena cava, into the right atrium. A picture for that again. Again, your palmar venous arches goes into the basilic vein. It can right into the cephalic vein, into the axillary, brachiocephalic, subclavian, back into the superior vena cava, into the right atrium. So there's going to be multiple pathways that the blood can come back into the heart from the veins. And let's do this one, then take a break. Because you can go for the deep palmar veins again. Go to the radial and ulnar veins now, coming down the sides. They'll form the brachial vein, and then axial vein, subclavian, brachiocephalic, superior vena cava, right atrium, same pattern. Okay, the only plan how they get to the axial vein now. So you start at the palmar arches, you go to the ulnar and the radial. Okay, those fuse form the brachial. Brachial flows into the axillary. Axillary goes to brachiocephalic, subclavian, superior vena cava, into the right atrium. Formation of the superior vena cava. Remember, the superior vena cava drains into the right atrium, drains everything above the diaphragm part of the body. So the following veins are going to drain into the superior vena cava, which then drains into your right atrium. The azygos vein and the brachiocephalic veins. Okay. Okay. Draining into the brachiocephalic vein is the subclavian veins and the internal thoracic vein. Okay. So both the subclavian vein and the internal thoracic drain into the brachiocephalic, And the brachiocephalic and the azygos drain into the superior vena cava. So here's your azygos vein. There's your internal thoracics coming up and the subclavian, and it drains into the brachiocephalic vein. And here's your brachiocephalic vein right here. It just drains into the superior vena cava. The inferior vena cava. The inferior vena cava drains the lower parts of the body into the right atrium. Okay, the following veins drain into the inferior vena cava, which drain the right atrium. So you have the common iliac veins, you have the lumbar veins and gonadal veins, and the hepatic veins. All four of those drain into the inferior vena cava into the right atrium. The gonadal veins, the right gonadal vein drains into the inferior vena cava. The left gonadal vein drains into the left renal vein and then into the inferior vena cava. So the right gonadal vein drains directly into the inferior vena cava. The left gonadal vein drains first into the left renal vein, then back into the inferior vena cava. So these are the left and right common iliac veins coming up to form the inferior, forming to the inferior vena cava. The lumbar vein, the gonadal veins, renal veins, all drain into the inferior vena cava, and the hepatic vein. Veins that drain the pelvic area. Okay. They drain to the internal iliac, and then into the common iliac, and then into the inferior vena cava. So the next veins drain into the internal iliac, the common iliac, and then into the inferior vena cava. You have your gluteal veins, the internal pudental vein, the obturator veins, and the lateral sacral veins. And from the lateral sacral veins, you have the medium sacral vein, which also drains in the left common iliac vein. So from the pelvic area, you have your obturator, your lateral sacral, your internal pudental, inferior gluteal, and internal iliac. Okay. And then the superior gluteal vein, and they drain into the common, right common iliac drain, and up into the inferior vena cava. On the backside, you can see the internal pudental vein, the superior gluteal vein a lot better, the inferior gluteal vein, and the obturator vein. Veins that drain the abdomen. Okay? The abdominal portion of the inferior vena cava collects blood from. Now, do you have a thoracic portion of the inferior vena cava too? Well, basically it has to get to the heart, but once it's through the diaphragm, it's the superior vena cava that drains all that area, but it has to get back up to the heart. So the abdominal portion of the inferior vena cava collects blood from your lumbar veins, gonadal veins, hepatic veins, renal veins, suprarenal veins, and the phrenic veins. Okay, all in the abdominal area. Here's your inferior vena cava that's going to drain right into the right atrium. Feeding into the inferior vena cava are your hepatic veins, lumbar, gonadal, and renal. Okay. So draining the lower limb, just like with the upper limb, you can have multiple pathways. In case something gets damaged, maybe there are multiple pathways draining the upper limb, you have multiple pathways bringing blood back into from the lower limb up to the inferior vena cava. So blood returns from the heart, from the feet, could be the following sequence. Go from your plantar veins, drains into the anterior tibial, posterior tibial, and fibular veins. That goes into the popliteal vein, back up into the femoral vein, to the external iliac vein, to the common iliac vein, inferior vena cava, right atrium. So there's your inferior vena cava where it's going to go into the right atrium right there. And we're going to do left and right common iliac veins, external iliac veins, drain into it. You see the femoral vein coming up. Popliteal vein drains into the femoral vein. Then you get your fibular, your post, and your anterior and posterior tibular. Draining up. Okay, or it could go from the dorsal venous arch to the greater saphenous vein, to the femoral vein, to the external iliac vein, to the common iliac vein, back in the inferior vena cava, right atrium. Okay, multiple pathways to get it done. And you can see the dorsal venous arch, the greater saphenous vein drains into the femoral vein, to the right external iliac, to the right common iliac. Okay, on the back view, you can see the same thing. Anterior tubular and posterior tubular veins. The fibular vein going to the popliteal, femoral, external iliac, inferior vena cava. Okay, the system in the liver, hepatic portal system. So blood from the small intestine, large intestine, stomach, and pancreas all flow into the hepatic portal system. So your small intestine, large intestine, stomach, pancreas, all that flows into the hepatic portal system. You have the inferior mesenteric vein, okay, drains a portion of your large intestine. The splenic vein drains your spleen and the lateral border of the stomach and the pancreas. The superior mesenteric vein, okay, drains a portion of the stomach also, the small intestine, and a portion of the large intestine. From the hepatic portal veins, venous blood enters into your liver sinusoids, your hepatic veins. Then from the hepatic veins goes into the inferior vena cava, into the right atrium. Okay, and you can see, here's your inferior vena cava, we're going to drain into it. Okay, everything below the diaphragm is draining into that. So you got your ascending colon coming up. You have the descending colon coming down. You have the small intestine, which is all this area here. Again, great blood supply because of the arterial supplies are also there too. Also, all right. So we spleen. You can see where it drains its blood supply from. The splenic vein. You have the inferior mesenteric vein. The hepatic vein. Okay, the superior mesenteric vein. Okay, all draining into the inferior vena cava as it goes up towards the right atrium. Cardiovascular system at birth. Okay, we talked about a little bit before the cardiovascular system, how there's shunts and pathways, so it's not the same blood flow once it's born. Okay, so the fetal cardiovascular system differs from the adult cardiovascular system. Okay, because the fetal lungs are non-functional. The fetal digestive system is non-functional. So you're not going to pump a whole lot of blood to the lungs or to the stomach because the stomach's providing no food, the lungs are providing no air. Okay, so both the lungs and digestive system are non-functional. So all fetal nutrition and respiratory needs provided across the placenta by the mother. So blood in the fetus, internal iliacs, enters the umbilical arteries. So instead of bypassing into from the fetal internal iliacs, instead of going down to the blood coming from blood going to the stomach and the small intestine, it's going to the umbilical arteries where it's getting its blood, it's getting its nutrition that way, oxygen and other nutrition that the body needs. Okay, so blood in the fetal internal iliacs goes into the umbilical arteries. It enters the umbilical cord and enters the placenta from there. Okay, so blood diffuses, blood leaves the placenta. It enters the umbilical vein. Okay, enters the ductus venosus, goes into the fetal liver, to the inferior vena cava, to the fetal right atrium. So it bypasses the small intestine area because there's no nutrient. It goes into the umbilical area where it gets its nutrients. So there we talked about two shortcuts that the heart uses that are both closed at birth normally. Blood in the right atrium can enter into the left atrium through the foramen ovale. So remember, it goes in the right atrium, right ventricle, so the pulmonary trunk, lungs, and back into the left atrium. So now instead of going, so here's your heart. Here's your four chambers. Okay. So blood comes in here. So instead of going to the right atrium, from the right atrium to the right ventricle, the blood can go from the right atrium to the left atrium and then go to the rest of the body. It bypasses the lungs. Some of the blood does go down through there, and blood in the pulmonary trunk can enter the aortic arch, okay, by the ductus arteriosus. So instead of going from the pulmonary trunk to the pulmonary arteries, it now goes into through the ductus aortus, goes into the aortic arch, where it gets distributed to the body. So there's two shortcuts or two short circuits in the system to prevent blood from going to the lungs. One is the foramen ovale, which allows blood to go from the right atrium to the left atrium. and the other is a ductus arteriosus, which allows blood to go from the pulmonary trunk after it comes off of the right ventricle, from the pulmonary trunk into the aortic arch. Okay, so there's your foramen ovale. You can see it's open, and blood can flow from the right atrium to the left atrium. This is a ductus arteriosus, and you can see blood flows from the pulmonary trunk, which is right here. I'll do that one in green. This is your right atrium, and here's your pulmonary trunk right here, and it flows into the aortic arch. So 2 bypasses, the foramen ovale and the ductus arteriosus. And you see the aorta, the pulmonary trunk. This is your inferior vena cava. Okay. The ductus venosus going into the liver. This is your umbilical arteries. This is your umbilical vein. Okay. It goes in the umbilical cord into the placenta. And that's where it receives all the oxygen, and that's where it receives all the nutrients.